All righty, I've got 3:30. We're gonna get started. My name is Rob Samari. I'm the Executive Vice Chancellor of the KU Medical Center, and it's an absolute pleasure to be with you today. In any given year, this activity is one of my favorites. Typically, it involves shared breakfast in the 50-year class. It always involves many of us learning a lot of things, notably from our alumni, but also from our students. So it is a real pleasure to be celebrating the alumni reunion weekend with each of you. So the beauty of what we're going to do is we have part of the present and part of the past with us. And we're going to try to figure out what's changed in the last 50 years around here and how the experiences are similar or how they are different. We're going to start off with introductions. I'd like you to introduce yourself, your program, your hometown. So for our alumni, that's where you came from originally. And if for the alumni, just 2 or 3 lines about what you did and what you're doing now. So we're going to start off with Ms. Rajvi Shah.
Hi everyone, my name is Rajvi Shah. As EVC Samari mentioned, I'm a 4th-year medical student from Overland Park, Kansas, and I previously served as a School of Medicine student body president for 2 years. Thank you. Thanks,
Rajvi. Ms. Hannah Brock.
Hi, I'm Hannah Brock. I am an N4 in the School of Nursing. I'm from Olathe, Kansas, and I'm currently the president of my nursing class, and I'm on the curriculum committee for the School of Nursing.
Thank you so much, Anna. Ms. Jessica Lemus.
Hi, I'm Jessica. I'm a 3rd-year physical therapy student from Lawrence, Kansas, and I'm also part of the PhD program for rehabilitation science.
So you can see we got a group of underachievers here today. So we're excited to have the current students here with us. And now, Dr. David Nelson.
I'm David Nelson, originally from Topeka, Kansas, medical school class of 1970. I'm a retired pediatric immunologist, having spent 35 years at the National Institutes of Health doing clinical molecular genetics.
Wow. Thank you for joining us, Dr. Nelson. Janie Clements Bailey. Janie, you're on either mute or didn't get the cue.
I'm sorry, you cut out.
Okay.
I'm Janie Clements Bailey, and I graduated from KU Nursing School back in 1970 and in the master's program in 84. And I have specialized in geriatrics, and I currently work at the Robert J. Dole VA as a nurse practitioner.
Terrific. Thank you so much. And Kamala Wilson.
There we go. Hi, I'm Cam Wilson. I guess my hometown would be Minneapolis, Minnesota. That's where I was born, but I really grew up in Kansas City after the age of 8. Graduated from KU's physical therapy program in 1970. Have done a lot of different clinical practice, have been fortunate to be on the faculty in 3 different programs, starting with KU Med Center, Shenandoah University in Winchester, Virginia, and just now retired from Wichita State University, chaired those a portion of each of those programs. I was an acting chair briefly for KU Med. So
great, thank you so much. So I'm gonna start with a little bit of a link. The class of 70 folks, how many of you tried to walk down the hill and didn't make it? Or tell me the story about graduation, Cam.
Well, I mean, we were all set to go. We were ready, and we had just a really terrific storm. Got really cool, and we were all crammed into the field house. And the next day, I have to say, I had the worst cold of my life.
So I'm sorry, I thought the graduation was canceled.
No, it went on in Allen Fieldhouse. Of course, you know it.
Okay, but didn't walk down the hill.
But you couldn't walk down the hill, and I was really excited that we were going to get to walk down the hill in 2020. I was all set to do that, and doggone, the pandemic canceled it this time.
I I was under the impression it was canceled, but it was moved inside for a limited number. Dr. Nelson, is that right?
Yeah, it was. It was moved inside. And I don't remember, I thought, if I recall correctly, we were we had a graduation in Kansas City.
Right, the hooding, I suppose.
And so this was, as I remember it, everybody in the class, the School of Medicine, stand up and you got your degree, sit down. And so that was the way it went. But the graduation where parents were invited in the old residence hall auditorium in Kansas City was very meaningful. I mean, that was a big deal.
Good. So typically, we can start from square one comparing experiences, but this year, our students are having an experience that nobody's ever had before on campus. And so I'd kind of like to start out level setting for each student to kind of, how's it going now and how does it compare to normal? And then we'll do the 50-year comparison. But Hannah, maybe start with you. What's it like today in the time of COVID compared to pre-COVID in your school?
Yeah, so for the School of Nursing, what we're doing now with COVID is, so the N3 class and the N4 class are switching off weeks. So the new students that just started are coming onto campus. They came for the first week, and then my class was online that whole week, and we did asynchronous learning and had sort of a little trial and error with that for our teachers. And then the next week we switched, and so then my class was in person and the N3s were online, and we've just been flopping back and forth every other week, which has honestly, I think, worked out great. And I'm super thankful that we get to do clinicals this year, because when COVID first happened, all of our clinicals were canceled. But
so
then,
Hannah, do you look forward to those weeks you're on campus and kind of catch up? I mean, how do you mindset that?
yeah, so it feels kind of like normal, because well, I guess as normal as it can be. They split my class up in half between two different classrooms, so I don't get to see half of my class ever, which is kind of unfortunate. But when we're in person, we have a group of 4 that we sit spaced out at 2 tables, and we all wear masks, and we still are able to do group work together, which I really look forward to, because when we're online, it's kind of like this, everybody has their cameras turned off, their mics turned off, so we don't really get to see each other or talk or anything like that. So I always am really excited when we're in person. I just feel more in tune with what's going on with my classes, and I feel more in tune with what the teachers want and things like that. Because just being online is just not the same. So
right. Jessica, what about you in the School of Health Professions? How have you adapted to COVID?
Yeah, so initially all of our classes were completely online, which was kind of tough because we have a lot of labs that are super hands-on with all of our classmates there. During the summer, they changed it so that like once every 2 weeks, we'd have a lab where it was literally quick and dirty, 20 minutes hands-on with one other classmate, and then there was 3 groups in a lab. And so we'd have to hand sanitize and wipe all the tables down before and after. It was just really quick. But this semester, we're all in clinicals full time. And so far, no one's had this clinical canceled. Everyone's been able to make it out. So right now, everything seems pretty normal. But beforehand, yeah, everything was online, which was pretty tough to handle. But our professors did a really good job of getting that curriculum out so we could at least still learn and continue on.
Rajvi, maybe you could tell us what's going on in the clinical 3rd and 4th years, but also maybe you could reflect as much as you can on what's going on in the first 2 years of medical school now.
Sure. I'll begin with my experience in March. I was on my neurology and psychiatry rotation, and so it was very easy to convert to telehealth visits. Well, apart from doing the physical exam, we were able to get the history and at least do med checks online. However, I really felt for my peers who were on their surgery clerkship, because you can't really do that over telehealth. The great thing is YouTube has a lot of new videos, and there are new apps out where you can have that type of book learning. However, as we know, the clinical experience is the biggest part of M3 year. And so now they've transitioned where you have a didactics week where you do a lot of lectures, but we are able to go back into the hospital now as long as we follow protocol. So that's great. Limited numbers, as Jessica mentioned and as Hannah alluded to, you know, some weeks half of the clerkship group is on and then the other weeks the other half is on. The M1s and M2s, thankfully, most of their learning is as is. They have the podcast, they sit at home and they watch the videos and they do their book learning. And as far as my class, we are on electives right now, and we are just trying to make sure we get the experience we need before we apply to our residency training programs.
Right, and Rajvi, no traveling for residency interviews this year. That's right?
That's correct. Yes, we will be doing them all virtually, all of our interviews. So that will be difficult to be able to parse out, where do I want to go for the next however many years? And basically, we'll just have to try to get a feel of the program online.
Right. Well, that kind of catches up of the changes, but let's start on some even playing field. Who were the most important educators in your years at the university? Who are the people that really changed your lives, or that really made a difference? Janie, do you want to start? Your years, who are the people that were important to you?
Sure. There were actually, three people came to mind for me. Rita Clifford was really an inspiration to me and really encouraged me. And there were two clinical instructors that I had that were just absolutely outstanding. They're not there right now, but Marty Barnard was a pediatric nurse faculty person, and she was just, she was incredible. And then also in my master's program, Libby Diani was on staff at the time I went through, and she was challenged me, I'll put it that way, and I really I learned a lot from her.
Fantastic.
So, yeah.
Kamala, what about in your time at the Med Center?
Well, I have to back up just a little bit, because then the PT program was split between the Lawrence campus and the Med Center. Okay, so we did our anatomy on the Lawrence campus and whatnot. And so probably the first faculty member that really had an impact was Jackie King. She was a PT at Watkins, and she taught the PT courses there in Lawrence. So Jackie was number one. Number two, when we got to the Med Center, has to be Jessie Ball. An incredible woman and instructor and everything, who made a huge difference. All of the PT students loved her. She was amazing. And then from there, of course, you know, there were some really good clinical instructors. I remember my first clinical instructor was Alice Buford at Dixon Dively. And then I had several clinical instructors at the Rehab Institute. That was my last rotation.
Great. And if you're in the audience and these names are ringing a bell and you got a story to add, go ahead and chat, and Christy will add that to the discussion, because these are important people in all of our lives. Dr. Nelson, who were the big dogs that you remember?
Well, the two people that I thought about this a little bit, I personally enjoyed Jacob Frankel very much, who
Dr.
was
Frankel.
a pathologist,
Yep.
who was absolutely very, very critical in terms of teaching about the precision of medicine, not only in pathology, but also in other ways. And then Jim Lohman, who was head of pediatric hem-onc, I believe was recruited to the University of Kansas from the University of Minnesota, I think as the heir apparent to chairmanship of the pediatrics department. This currently, when I was there, was chaired by Herb Miller. But Jim was a real academic pediatrician trained at Minnesota, which is where I ultimately wound up going for my internship and residency. So those are the two.
That must be the Miller building for those who are currently on campus.
Yes, he was very big on developmental pediatrics.
Rajvi, who are the, myself excluded, so don't mention me, but who are the people that are important? The folks that your classmates sit around and say, oh yeah, that's the person that's impacted us.
Sure. Dr. Mathur, he's a pathologist, and I think almost every medical student can attribute a lot of our knowledge to him. Just being able to look at the histopathology slides and really see different cells from each other.
Yep.
And then Dr. Swint Cruz, when it comes to biochemistry, she's
Yep.
great.
Liskin Swin Cruz are there. I believe the first female to run a basic science department at the university. Jessica, who are the folks that now, Dr. Akinwanton, Dean Akinwanton's on the call, so you got to be a little careful. But Jessica, who are the folks that you would identify?
Gosh, it's so hard. They're all amazing. We've all had really good connections with them, but Dr. Steve Jernigan, of course, stands out. He's super personable, always cracks jokes in class. Dr. Rucker was amazing. We learned a lot in all of his courses. And then I love Dr. Patty Cluding too. She's been super helpful. It stinks that her class got cut short by COVID.
Patty is a wonderful person. Hannah, who would you identify?
Dr.
Hold on. Dean Akinwanton's got to ask why he wasn't named.
I will just echo what Jessica Page said. The PT department is a great department. It's built more like a family, and they look out for one another, and they pride themselves in giving the students the best experience.
Great. Thanks. Hannah, who would you guys identify?
Yeah, so I know for us, we love Dr. Clanky Borgman. She teaches our pathophysiology class, and she's amazing. And then, unfortunately, she's not here anymore, but Professor Beth Young, she was just a light in our first year. She was amazing, too. So I think those two professors really stuck out to all of us, I think.
Great. One of the things that has changed for a number of reasons is tuition. So real quickly, we're going to start with the alumni. Give us an idea what tuition was when you were in school. Kamala, what was it when you were in school?
Well, it was nowhere near what it is now. I can't even remember because my undergraduate tuition was paid for by my parents. So I'm very grateful to them. So I'm not really sure, but we're talking maybe $250 a semester. I honestly don't know.
Students, keep your eyes in your sockets there. With Janie, what was tuition for you?
Again, my parents paid for my undergraduate education, and my sister, who was 2 years behind me. And I hate to say that during that time, the nursing program was a 5-year program, not a 4-year program. So my parents ended up paying for 5 years for 2 students. So, but, it was well worth it. So I'm very thankful.
Dr. Nelson, what'd you pay for tuition?
I only paid tuition for 1 semester, and I think it was $500. And after that, my tuition was paid for based on academic performance.
So you were on scholarship, if you will, right?
I was. So one of the keys for getting people into biomedical research is having them come out of undergraduate and medical school debt-free.
Right.
Now they have the freedom to pursue whatever career they might be interested in without having to consider paying off debt, and that was my case.
Right. Dr. Nelson, did you go into the military at all, or were you at the NIH during that time? Or
I had a 28-year, 6-month and 1-day career in the United States Public Health Service as a commissioned officer, and that was an alternative to the Berry Plan for me. So during the Vietnam conflict, you could sign up for some sort of military service, delay your induction until after your residency program was over. So I signed up for the United States Public Health Service and served there for my, what was a complete career, really. 28 years, 6 months, 1 day.
So, okay, guys, embarrass me. Tell them what your tuition is, Jessica.
Gosh, quite a bit more, unfortunately. I think all in all, my undergrad was about 40,000 altogether. And then right now, I think it's pretty consistent, probably 10,000 a semester, a little bit more.
Hannah?
I think it's about I think it's like 13,000 a year ish. So around yeah, my parents helped me pay for it as well, so I'm pretty sure it's around 13,000 a year.
Okay, and Rajvi, if you want to mumble when you say this, it would be appropriate. But no, go, tell them what it is.
As an in-state applicant, my tuition is about $38,000-$39,000 a year. However, if I were an out-of-state applicant, it would be about $96,000.
Yeah, that's not tuition. No, it's lower than that actually.
It's lower. Okay.
Yeah, it's about 68.
68.
So this is when I put my endowment hat on and say, look at the return of investment for the minimal investment that you've made for such wonderful careers. And if you're thankful to the University of Kansas, we'll be in touch. No, but it's incredible. The state's contribution, you know, I was class of 86 in medical school. You know, the state's contribution has dropped like a rock. The students' contribution has gone up. The total cost has gone up. Everything has changed. Everything has changed. All right, so I'm struck by the three alumni that I'm not sure that they would have painted the path they took when they were leaving school here. Dr. Nelson, was there such a thing as a molecular clinical geneticist when you were in medical school?
Okay,
and if so, real quick story, how did you get to that career? Because I know these guys are thinking about careers that might not be present now in the same way. How did you get there?
Okay, so how I got there was I was leaning towards pediatrics, and for research day, when I was a third-year medical student, a physician by the name of Dr. Robert Good from the University of Minnesota came to the University of Kansas, and he was talking about the two-component system of the immune response. And he was talking about chickens that had had their bursa removed and were agammaglobulinemic. And he was seeing children who had agammaglobulinemia. And he was talking about children with the DeGeorge syndrome who had no thymus, and they seemed to have a different problem with their immunity. At the time, 1968, lymphocytes wasn't known what they did. So this guy was talking about, you know, two-component system of, you know, cellular and humoral, and nobody had recognized that that was the way it worked in humans. And I said, I got to go work with this guy. So I was never on vacation in medical school except for between my year 1 and 2. So I finished 6 months early. I went to the University of Minnesota and worked with Bob Good in his lab. And that really set my career path. At the time, the University of Minnesota Department of Pediatrics had trained more department chairmen of pediatrics than any other program in the country. In my internship group, out of 15 of us, there were 12 MD PhDs and 15. And so rather than being sort of the weak sister of the departments as it was at Kansas when I was there, the Department of Pediatrics at the University of Minnesota was the strongest, you know, department, one of the strongest departments in medical school. So no, there was no clinical molecular genetics. But my career was focused around kids that were genetically predisposed to develop cancer. And so we were interested in those genes that made them susceptible as targets for diagnosis and therapy. So it starts with what chromosome is this disease on? What band of that chromosome is this gene located in? How can I get more definition of what's on that band? And so it just evolved. But yeah, it was a tremendous experience. So anyway, that's my story. It started.
It sounds like
research day.
Sounds like you were recognized as a pretty bright pretty bright guy to begin with, and your curiosity took you in very exciting places. Kamala, did you always intend to be a faculty member and teach?
Well, not really. When I first graduated, I thought I wanted to be a pediatric therapist, but the positions that I was able to get for where I was going to, my husband and I were going to be, was in acute care in Topeka. So that's where I started out, and then we ended up in Kansas City, and I started working in a long-term care facility. Oh, and by the way, I do want to add, because you talked about the tuition, but you didn't talk about how much salary we earned. So my beginning salary as a PT in Topeka, Kansas in 1970 was $3.90 an hour. Okay. After 6 months, I got a bump up into $4.10 an hour. And that was a pretty good wage for PTs at that point. So anyway.
Well,
so,
it's important to keep that in a perspective.
Yeah, you got to keep that perspective. So anyway, so while I was working at the long-term care facility, I decided I really wanted to look into the pediatric therapist. So I started the special ed program at KU Med Center. I'd spent a lot of time in the Miller building. And my clinical supervisor was Carolyn Hariza. And at that time, she said, there is an opening in the PT department for the clinical coordinator. You would be good for that. And I said, well, I don't know. Both my parents had background in teaching. So I said, oh, what the heck, I'll give it a shot and apply. I don't know that they'll consider me because I was working on my master's degree, but I didn't have it. And by gosh, the faculty took a chance on me and hired me. So I started out as a teaching associate and then worked my way up through instructor and assistant professor. And in the meantime, while I was there, I decided I did want to stay in teaching, and I loved it. I liked working in peds, but acute care and geriatrics was really my clinical forte. So,
Janie, did you have plans in school that you kept to, or the chancellor likes to say we're going to take a lot of jobs in our lifetime. Did you have some twists?
Actually not. I started out actually as a psychiatric nurse, and I did that for a couple of years. I really never enjoyed med-surg nursing in the hospital, but I ended up doing home health, and that just kind of led me into geriatrics. And when I went through my master's program, that's what I focused on. And so that's how I ended up in geriatrics pretty much.
So, so from the student perspective, Jessica, your PhD in DPT, what are your plans?
So I hope to work at a facility similar to KU where I could teach, also practice PT in the hospital somewhere in a clinic, and then do research with Parkinson's disease.
Okay.
Yeah.
Well, terrific. How long do you have on your PhD?
Well, I just applied, just got in not too long ago. So just starting out, but hopefully, yeah. With my experience in the lab already, hopefully it'll be about 3 or 4 extra years.
Great. And whose lab are you going to be in, or do you know?
Not for sure. Yeah, I've been working a lot with Dr. Liu, and he's been great.
Perfect.
Very helpful.
Perfect. Yeah. Hannah, what are your plans?
Yeah, so right now I actually work as a nursing assistant on the neuro ICU at KU Med, and I love it. I'm very interested in neuro, so I will probably end up there, and I have plans to hopefully get my doctorate, and I just don't know when yet, but eventually that's the plan, and become a nurse practitioner, hopefully in the acute care setting. So
Great. Rajvi, where are you headed?
I am applying in anesthesiology. Hopefully the match bodes well for me in March. And I'm thinking about doing a fellowship in critical care after I complete my residency.
Well, that's terrific. And how many your classmates you think will do anesthesia, just out of interest?
Right now, I think there are 12 of us that are applying anesthesiology.
Okay, gotcha. All right, so neighborhood changes, time changes, living conditions change. Where did our alumni live when they were on campus, when they were on school? Did anybody live in the dorms, or Janie?
Yes, I lived in the dorm. I'm not sure we may have even been required to live there unless we were married. I don't remember, it was so long ago, but it was a good experience though. You know, I really got to know my classmates really well and, you know, forged some really good friendships there.
So Janie, this is the Eleanor Taylor building we're talking about?
Yeah. Mm-hmm.
Still
That's right.
there.
Yep.
Some lucky vice chancellor is going to get to take that down. I hope.
Yeah. Well, I know it used to get real cold on this one side and things would freeze or ice over near the windows.
Still does, and water leaks. And Janie, were these were there curfews, and were you in the day of the hat? Did you?
Yes.
What did you have to wear on the wards?
Yeah, we had hats and they were really flimsy. I mean, you know, they had to be ironed practically. You know, yeah. And I remember when I first started out nursing, staff nursing, I worked in Denver for a while on some med-surg units. I had to wear the hat, you know, and it was just actually, it was kind of a hassle, to be perfectly honest.
So did you wear a skirt, a dress, or hose? What else was part of the outfit?
Yeah, I wore a white uniform, white uniform, and sometimes I'd wear white support hose too, you know, but, you know, I was pretty much dressed up as the nurse back then, you know.
Anna, you've been fitted for your white uniform. Is that still part of the deal or not?
No, not anymore.
What would you wear on a day? So as a nursing assistant, what would you wear?
Yeah, so I just wear, KU doesn't have any sort of dress code on what color scrubs or anything like that for most units. So I just wear regular scrubs from, like, you know, sometimes I have them from Walmart or like from Figs, you know, something like a little bit more expensive, but that's pretty much what all the nurses wear. I don't think anybody has to wear anything specific, just whatever scrubs they want.
And Hannah, where do you live in the area?
I live in Olathe with my parents.
In Olathe.
Mm-hmm.
All right. Dr. Nelson, where did you live on when you were here?
For the first year, I lived in a dorm, and for another year, I lived in a house that was 1 block east of Wall Hall and 1 block west of State Line Avenue. That's been demolished. And then my wife and I lived in an apartment over on 43rd Street that was on the west side of Rainbow Boulevard.
So the dorm for medical students, I assume, was over the student center.
Correct.
Battenfeld.
Correct.
And now, was there ever, you know, people that went between the dorms, or did that not happen at the time? You know, that you might go to visit somebody in the girls' dorm or visit somebody in the board, or did that not happen?
I don't know that there was a girls' dorm. I was looking.
There was the nursing dorm.
Well, I don't know about that, but
yeah, okay.
I was amazed that in my class, I just looked, of 115 students, there were only 6 women. I mean, it's just amazing.
Wow.
To me.
Yeah. So did you meet your wife while you were here as a student?
No, I met my wife in undergraduate, and we married after my first year in medical school. We wanted to make sure I survived my first year of medical school.
Yeah, I was in the same situation. I think she wanted to make sure that I survived the first
year. Now we've only been married 53 years, so.
Congratulations.
You bet.
Rajvi, where are you living?
I live at the Vista Condominiums. That's right across from the street from the health education building. I believe it was called the Rainbow Towers,
yeah,
maybe.
Lots of students in there. How are they kept up? And it wasn't probably here in 1970. I don't think it was that old. It was here when I was a student in the 80s, but are they kept up pretty well, Rajvi?
They are, yes.
Good. Kamala, where did you live when you were at school?
I lived with my folks.
And where were they?
They lived out in Merriam.
Merriam.
Yeah, just off of Highway 50 back in those days. Now.
So, Hannah, how common is it to be living with parents, do you think, these days? Is that pretty common?
Yeah, I think so. There's a pretty good chunk of my class. Like, I think all of my friends, we all live at home, and it was just logistically speaking, it's a lot easier. I just hop on I-35 and it's probably like a 25-minute drive for me. So it's really pretty common, actually.
Gotcha. Jessica, where are you living?
Like Rajvi, I'm also at Vista, right across the street. So nice and close.
Sounds good. So, Dr. Nelson, when you were here, where were the big lectures held?
Wall Hall.
Wall Hall
The
East.
big lectures were in Wall Hall. Now, that was right on 39th, as I remember.
Yep.
Yeah, there was a big lecture hall in Wall, and then there was a smaller lecture hall where we had pathology and stuff like that. And I don't remember, that was in another building, but it was.
You think it was
kind of
it was Clendenning?
Yes.
Yeah, so Wall Hall East is where I took most of my classes, and at the time you came in straight from the outside, guys. You didn't go through the atrium where you come in now. It was straight from, there was no atrium, there was no lead Hickson there. It was just straight in and
Straight in from the street.
yeah. Kamala, where did you have your lectures?
Well, we had all of our hands-on labs were in the basement of Hinch, which obviously is gone now. So
Gone now.
right
I
there
have
on-
a brick from Hinch.
Do you?
That's about all that's left.
I think the OT and the PT faculty offices were up on the 5th floor, which,
Gotcha.
yeah, we were told if you wanted to go up to talk to faculty, you had to take the stairs. Mrs. Monteith didn't want us doing the elevators and tying that up. I think lecture classes probably, when we had shared classes with the OT students, we were in the auditorium there in Eleanor Taylor, in the basement of Eleanor Taylor.
Janie, what about you? Where were your lectures held?
You know, I'm not sure I even remember. I mean, I think Hinch Hall, maybe in Eleanor Taylor, but it's just been so long ago. I don't really remember.
Janie, when I came back after 30 years away and mostly at the Mayo Clinic, I couldn't remember where I took classes. And
Yeah.
I asked one of my colleagues, was I ever in this Battenfeld? And she said, you took National Board sitting next to me.
Well,
recall.
you know, it's changed so much since I've been there. I mean, you know, I've visited a couple of times, but.
And you know, the changes are enormous.
Yeah.
And I'm going to let the students tell us, what's it like taking class in the health education building now? Jessica?
Yeah, I really like it. There's screens everywhere so we can always see from where we're sitting. Speakers, they always have their microphone on so that we can hear no matter what. They're all recorded, which is nice. And then we have our simulations up on the 5th floor, which are really cool too. So I like it a lot.
So what's been kind of the most fun parts of the simulation experience?
Well, our first one was like an acute simulation. So our dummy that was laying down there had like respiratory distress or a PE. So it was really fast paced. It's kind of funny because it's our professor's voice talking through him, but we're moving him all around and super lifelike. You can hear him breathing and see his chest move. It was really cool.
Yeah, it's always fun to take your own pulse and see how activated you are with this piece of plastic in front of you, right? But
yeah, definitely.
It's not a piece of plastic. Rajvi, what's your experience been like in the HEB?
I mean, it's a beautiful building, and I will say Jessica's right. The simulation part is amazing, and it does feel so real when you're in it, especially when you learn a new concept and you're expected to apply it, and being able to have that foundation and having feedback, debriefing, and then being able to do it again. I think that's part of the rewarding parts of having a simulation, is learning from your mistakes and knowing that you can ask for help. I will also say working with the nursing students and the respiratory therapy students is one of my favorite parts of the simulation, because rarely do people feel comfortable asking for help, but in that scenario, it's great to know that other people have information that you might not know. We work with pharmacy students, and so having them be able to dilute medications for us, having the nursing students hang IVs for us is a great great learning experience.
Rajvi, have you had that experience where you learned it in simulation and you find yourself in a live clinical environment and you're thinking, I got this?
Mm-hmm.
Because
Yeah,
I've been through this. I've got this.
Mm-hmm. It was actually the first time when I was on the internal medicine in the wards, and we had a patient that coded, and I was in the room with the nurse, and knowing to first, alarm the system, get help, start and being in a scenario like that where you've practiced, you've done compressions, for how long to be on the chest, how deep your compressions have to be, the different steps that need to happen, oxygen and everything. So I think that was probably one of the biggest learning experiences of my life, most likely.
Right. Hannah, what's your experience been like in the HEB?
Yeah, I love it. I was actually, super fortunate because last year we got to do all of the simulations and everything with the medical students and all of that in the HEB. And, now with COVID and everything, I don't know if the N3s are getting that experience. Right. But it was amazing. Like I loved it. And the HEB just has so much technology and so many things that are so helpful. I love that they record our lectures, and I love that for the School of Nursing, we have like a Salina campus too, and we video conference with the Salina campus for every class, and so we have them up on a screen so that we can see them, and it's a great building for sure.
Great, thank you. So for our alumni, if there's anybody here that wants to tell a Jimmy Bowers story, would there be anybody here that would want to tell a Jimmy Bowers story from the jigger? Dr. Nelson, did you find yourself in the jigger a time or two?
I was not over there that much, although, as I said, I was 1 block away from State Line Boulevard. That's where I lived. And so I would have to admit that I ran a few 6-packs of beer across the state line from Jimmy's Jigger over to where I live. But, I was so intent on academic performance that I didn't spend a lot of time over there, but I know many who did. One of the great stories that I remember about Jimmy's Jigger was there was an automobile accident that occurred right outside that thing, and it happened to be on the east side of State Line Boulevard. And the ambulance would not transport that person to the medical center because it was in Kansas. They turned around and took that patient someplace to some Missouri hospital, which, of course, to all of us who were there, it seemed like the craziest thing that would ever happen. But it was right there on the corner. And, it was the State Line Boulevard. You're not coming over here. So
literally in the shadow. And then
yeah, exactly.
Janie, did you or Kamala ever find yourself in the jigger?
I wasn't really a drinker that much, but I did go there a couple of times with friends, so, but I didn't inhabit it a lot, but I remember how big it was. I mean, how it was a hangout, definitely a hangout.
So one of the folks in the audience said at her undergraduate graduation in Lawrence, Jimmy had a larger group attending than the state governor did. Yeah. Pamela, did you ever find yourself at the jigger?
Well, we really didn't get there much because the way the program was, the fall semester we were at the med center, and then into the spring semester we had our finals and our boards, and then we went out on clinicals. So there was really only that fall semester, and that was so intense that we didn't have a whole lot of time. We had classes Monday through Saturday.
So to the students, so are there places that people hang out more than not, or is this the bowling by yourself generation, or are there hangouts? Where do people meet up? Jessica, you look like you're going to say something.
I'm trying to think.
Okay.
My friends and I like to go to Up Down because they've got a lot of stand-up kind of video games there.
Down on the boulevard.
Yeah, that's fun. Our class is actually kind of more into kind of physical activity like rec leagues and stuff, and so we've got a lot of those games that we like to all hang out and do together.
Right.
But yeah.
And Rajvi, can you help her out at all? Are there places you guys hang out?
I feel like a lot of the nursing students I see just going to Tanner's across the
Yep.
street, like whether or not they're just gonna go grab dinner or like a few drinks. Like I feel like I always see people just going across the street to Tanner's like at lunch or right after class or something like that. So
So Tanner's is on the block caddy corner to the HEB, which would, I'm trying to remember what was there. There was a gas station. I think there was a gas station there when back in the 70s and 80s.
For the students, we have to, those of us in 1970, have to remind them that at that time, Kansas was a dry state. You could not buy liquor, buy the drink in Kansas. But over the state line in Missouri,
right,
you could buy liquor, buy the drink.
So you had to join a club in Kansas at the time.
Exactly. And
Right.
bring your own bottle and they would store it for you or whatever.
Right.
So that was what the attraction was of this bar that was just on the east side of State Line Avenue.
So Dr. Nelson, did you do a rural preceptorship, and if so, where?
I did a rural preceptorship in Buckland, Kansas at the time.
Buckland.
It had a population of
Now, I know where
700.
Buckland is, but there's probably
700.
people on the line that don't know where Buckland is. Can you?
Buckland is about 20 miles somewhere from Dodge City. I'm not so sure exactly which direction, but it was an 8-bed hospital that I slept in one of the rooms, and the people got whatever kind of food they wanted. The staff in the kitchen would make whatever anybody wanted, and those people wanted to go to their own 8-bed hospital. They didn't want to go 20 miles to Dodge City.
So did you find yourself doing stuff there that you maybe didn't have an experience to do here in Kansas City?
Well, I did 3 unassisted deliveries when I called I'd done about 23 as a 4th-year student.
That's
but they were
impressive.
all, but three unassisted when I called my preceptor, and he said, "I'll be right there," and he never showed up. So yeah,
Do you think he was on vacation? Because that occasionally happens.
It might have been like having a locums there. I'm not sure, but I also remember, one night they called me, that they said somebody looked like he wasn't doing well, and when I got there, this guy was dead as a doornail, and he was livid, and I just figured, there was they knew what they were doing. They didn't want this hotshot medical student down there resuscitating this guy whose time had come to go. And this guy was cold. There was no question about whether or not he was doing well or not. He was cold. So
you didn't need to get that rhythm strip, did you? It was
no.
Rajvi, have you done your preceptorship, or what's planned for you?
I did a rural rotation for family medicine during my 3rd year in Baldwin, Kansas, which is south of Lawrence. And then I have another rural rotation in February. However, I'm not sure where I'll be going yet.
So what was the practice like in Baldwin?
It was great. It was really just outpatient clinic. We saw everyone from 6-month-old checks to 89-year-old dementia checkups. So
great. Janie or Cam, you guys didn't have, there was no simulation as we now know it. What were the scary first things you did on a living human being that made you really nervous or uncomfortable?
Oh my, I just remember initially, I hadn't even worked as a nurse's aide. So even initially, people with tubes were really frightening to me.
Right. This thing
was pretty
sticking out
bad.
of somebody. Yeah.
I was pretty naive,
Right.
So, but we had labs where we tried to insert NG tubes into each other.
Ooh, how'd that go?
And that didn't go very well. No, I really couldn't tolerate it. So, and we tried to start IVs on each other too. So,
yeah. Cam, any experiences with firsts in living patients that you might say, now it might be better to have that simulated?
Well, we didn't have simulating.
Right.
We did each other. Probably one of the most, frightening, but just really eye-opening. I had a patient up on the ward at the KU Med Center on my rotation who'd had valve replacements, and was going up and doing some exercises. And so I go up, and she start to go in the door, and she was in full code. The whole team was in there, and they were doing the compressions and everything. And I just turned around and walked back out. Thought, no, I'm not going there.
Yeah, you had seen enough of that. You had
Yeah.
seen enough of that. To the current students, now with simulation and mannequins, do you guys do anything to each other as students? I mean, are there any times where you are, putting IVs in or checking a NG2? Are there any experiences like that anymore, Rajvi?
I know there are a lot of hospital policies about what we're allowed to do to each other, but every now and then we'll steal away one of the ultrasound machines and just try to use that to learn anatomy. We'll also use like a POCUS ultrasound machine when we try to do nerve blocks, but of course we're not allowed to actually do them on each other, but we pretend as much as we can. Right. Jessica, Hannah, any people teaming up for any procedures or nothing?
Not that I can think of. I know that there was a story of a nursing student who practiced like NG tube. Well, not practice, but she did put an NG tube on herself to make a patient feel less scared. That's the only thing I can actually think of with like people doing practicing things like that on each other. I don't think so.
So it's all about timing, Hannah, because Werner Forssmann took an NG tube and put it into his jugular vein and put it in his heart and won the Nobel Prize for the cardiac catheterization. So she was this close to a Nobel Prize putting the own NG tube down. She'd just been a little earlier, and in the jugular vein, she would have been. Jessica, do you find yourself doing any physical therapy on your classmates as part of the standard care?
So we kind of learn modalities like ultrasound and e-stim and stuff on each other, so we can talk to each other about what it feels like and make sure we know what we're feeling when we do it to our patients. And then we do like all of our manual stuff on each other again, so we can get that feedback right away, whereas a mannequin probably couldn't tell us too much about our pressure and stuff like that. Right.
I'm going to ask if anybody has questions for the panel. Go ahead and add the chat, and Christy, go ahead and interrupt me. And I think I know the answer to this question. I'm going to ask Dr. Nelson. I'm going to ask you, what did you do for fun during medical school? But I have a feeling you were studying the whole time, Dr. Nelson. Is that?
No, actually, one of the things that was really fun was, and I heard it, maybe. There were a bunch of us that played on a medical school basketball team. Really? And we played in an industrial league downtown that involved the, Kansas City baseball team would have a team in there. And the thing that was cool about that was virtually all of the guys that played on this team had played college basketball. So there was a guy, Dave Nelson, who'd played at Kansas State, who had played in the Final Four. There were 3 or 4 guys that had played at Kansas. And so this medical school basketball team started a front line that went 6'7", 6'8", 6'9", 6'10". Wow. And it was probably the best basketball team I ever played on. A couple of guards, had played other places, Creighton and other schools like that. So no, we used to do that, and that was a lot of fun.
Wow!
So that was a great thing. But it was an industrial league. I mean, we used to go downtown. I don't know where, but it was pretty rough at times. So
that's 2 very unusual things you told us. The first is, a medical center team with the height on the front line. But even more unusual is when you mentioned K-State in the Final Four in the same sentence. So I'm a Jayhawk. So
well, and the other thing that was really cool is that we got to compete in the university intramural championship. Wow. And we actually played the law school in the finals, and the law school, of course, had the same ringers that we had. Most of the guys in law school had played college basketball too. So it was a real deal, but it was a lot of fun. So,
and we want to know, did the
medical school won?
Of course. Thank you very much. Janie, what'd you do for fun during school?
I have to admit, I was a real studier, okay? But I did one time skip classes, which is very unusual for me. And another nursing student and I went sailboating to medical students.
Where was that?
Well, I'm trying to think, is there a
Lake?
Shawnee Mission
There is
Lake?
Shawnee Mission Park.
I think it was Shawnee Mission
Yep.
Lake, and I remember that we capsized. So it
Wow,
was
you
kind of,
survived.
it was a weird experience, but it,
Wow.
you know, it was exciting.
Wow. Wow. Cam, any ideas what you did for fun back then?
Well, we always made sure that after a hard day, we would take 1 hour out at night, usually watch a favorite TV program. So that was when Marcus Welby was big. We'd make fun of, you know, how he did the physical therapy and everything else. And Michael Parks had a show about, he rode a motorcycle across the, I mean, so every night we made sure we had our favorite TV program, and for 1 hour, we just zoned out and we watched the TV program, and then we'd study for the rest of the night.
Okay, so here we are, 1969, sitting in front of a television, watching it on broadcast TV at a single time. Rajvi, how many screens do you own? How many screens do you own? How many of these supercomputers do you have at your disposal at any one time?
I have 3, and most of my peers have 3. We need one to actually take our notes on, the other one to play our lectures on, and then a personal one that we use for games and TV.
So 3. Hannah, 3? 3. Jessica, how many screens? 3? And Rajvi, when you watch a lecture, do you watch it at 1.0?
No, Dr. Samari, I watch it at 2 times speed.
Wait a minute, 2 times?
Yep. There's only so much time in the day, and occasionally there are a few lectures that everyone knows. We have to install a special extension on our computer so we can do it by 3 times speed.
So what does 3 times sound like?
Well, once you do it enough, you get trained, you know, to listen to it. I can't even listen to podcasts now on 1 time speed. I have to try to listen to it on 2 times.
So Rajvi Shah 2.0. Hannah, what about you?
I completely agree. I think that's so funny because, yeah, I find myself now, I listen to something at normal speed and I am just thinking, wow, this is so slow because there's just not enough time in the day, and you have to listen to it at 2 times speed, or you're just not going to be able to get through all your stuff that you have to do. So
Jessica, you're a 2.0 as well?
Of course. Definitely a 2.0 kind of person.
So what's should we be talking faster during lectures? Is that, I mean,
I don't feel
Or
like it's as
slower.
bad when you're in person. I feel like we're able to, you know, sit and have that conversation. And I don't know, our classes are completely discussion based. We have lecture, of course, but lots of
Right.
discussion. Whereas online, it's just them talking to us. And so, yeah, that 2 times speed really helps.
so you can watch a 50-minute lecture in 25 minutes.
Dr. Smear, we do have a couple of questions on the
Perfect.
chat and a couple of memories.
Great.
One of the questions is for the students about how they work with teams across the disciplines. I know we touched on that a little bit, but.
Kansas has the Med Center has a long history of interprofessional education. Goes way back, including potentially the 50-year group. But what kind of experience have you guys had, the current students?
I can speak to that a little bit.
Perfect.
I know my first semester and second semester, we're supposed to do it, you know, pretty much every semester, but with COVID, it's going to be a little different. For the nursing students, we start off with like the first year medical students in our first semester, and we do like a non-emergent situation type simulation, and I think it was sepsis or something like that. And then with every simulation with the medical students, it gets more emergent and more life-threatening. And then we do debriefing after. There's nursing staff and medical staff, and we all just kind of sit together and kind of talk about what happened. And the two that I've done, I loved it. It was so great to work with the medical students, and it's very interesting to see what we both are doing.
Rajvi, have you been in the family medicine interprofessional clinic?
I went rural for my rotation, so I wasn't able to participate in that.
Gotcha. Jessica, any experiences in interprofessional education?
Yeah, so we work a lot with the OTs, of course, and especially in JSTART, our pro bono clinic. But we also have like group meetings and a small simulation with med students, nursing students, and pharmacy students, which is a lot of fun to get to know everyone.
Christy, next question.
We've just got some memories to share. Let's see, Dr. Cox from the MD 70 class said that he rented a house that was owned by Jessie Ball from the PT program and knew her. So as we were sharing memories earlier. And then Dan Westfall said he was from the MD 70 class and no one can forget the great clinician, Dr. Delp, and also Dan Azarnath. He did research with him and he thought that both were brilliant and had a lasting effect on him. And then let's see, you asked about people whose career paths had changed, and Anita Schumann chimed in. She graduated in 1990, started in respiratory care, and then home health, and then pharmaceutical research, and she's about to celebrate 22 years on the phone as a telehealth nurse.
Wow.
So not something that even existed when she graduated.
Wow, that's terrific. We're at the bottom of the hour, but I want everybody to sort of maybe sign off with the alumni. What was your most memorable experience here at the Medical Center? Janie? I have a feeling this group's going to say studying, but let's maybe try to aim a little higher. Janie, do you have anything that really stands out as a memory?
You know, I think not really. I think it's probably just the friendships that I made while there. You know, really deep friendships. Yeah.
You keep some of those, Janie?
Yeah, I think those are probably my biggest memories.
Great.
You know.
Dr. Nelson?
You know, I was taken by simulations. I hear about simulation. One of the great things for me about my experience at KU had absolutely nothing to do with that. I believe that for my 2 clinical years, I was on call every 3rd night. Whenever my resident was on call, I was on call. So that when I went into my internship, I had probably more practical experience in terms of patient care than any other of the interns, because they just weren't allowed to do procedures. They hadn't seen things. They hadn't been present when care was being delivered. And so there were no simulations. There was a cardiac arrest. Yeah, it was for real. There was no simulation. And that see one, do one, teach one, you know, that. So that was, I would have to say that was the biggest thing. And I would just share with the students, I was laughing about this. You know, the fiber optic scopes had not even been invented. So there was none of that endoscopy stuff. And we didn't spend hardly any time at all learning cross-sectional anatomy or sagittal anatomy, because the CT scanner and the MR, they hadn't been invented. So there was no need to know the cross-sectional relationships of anatomy. So that was something we didn't need. You know, their pictures were in the anatomy text, but we didn't spend any time on that. So it's very different.
What Dr. Nelson is saying is that, we have trained generations of outstanding interns and residents and people who leave the School of Health Professions and Nursing quite prepared. And Dr. Greenberger used to say, we train a lot of A motors, people with A motors, but sometimes they had C minds. Now, Dr. Nelson was not one of those, but we train a lot of people who know how to take care of people. And it's really the legacy of our schools. Cam, any favorite memories?
Well, I just think as a class, we all pulled together for each other to get each other through, and just understanding that we weren't going to know it all. but that we had a good foundation, and you know, you just ask for help. And as I've continued through my career, just how important it is to give back, because it was a tremendous foundation that I received from KU, and then just the opportunity to teach there for 15 years. And it's a great profession, and I compliment the students who are with us, because all of the health professions are truly amazing, and you will make an amazing impact on your patients. So good luck to you all.
So there's no better way to end than those three sentiments. One, we make a lot of friends, and there are friends for life. Two, we're well prepared for the next step in the hands-on caring for patients. And three is we need to pull for each other, especially in times like this. So what a wonderful way to end. I can't thank all of you enough. Students, incredibly well representative of our schools, and alumni. I know there are a lot of people out there that couldn't get in or couldn't participate, but we really are grateful to each one of you. So thank you. I hope you have a great rest of the weekend. I hope you get a chance to see some classmates, and we're very proud of each one of you. And thank you for being here. And we look forward to seeing you at another time on campus. Thanks so much.
Thank you.
Good night.
Thank you so much.
Thanks.